it's a Senate room. I don't know all the tricks. I'd like to call the task force to order today. We do have a quorum because we will be taking a vote on the task force actions this year. The first part of our business today is, approve the minutes. Yep, so have you had a chance to look at the minutes, Co-Chair?
I have, and I would move their approval.
So moved. Any opposed? All in favor?
Aye.
Aye.
Action passes. Oh,
Any opposed?
any opposed? I already asked that. I'm learning this job, so. All right, motion approved. There we go. Part two. Would Andrew from the LCC come on up? And sir, if you could state your full name and your title, and we're looking forward to hearing your report.
Thank you, Mr. Chair and Madam Chair. My name is Andrew George. I'm nonpartisan staff with the LCC, assigned to compile the report for the task force. We're just going to walk through the draft report as it is right now. On page 3 is the executive summary outlining the background of the report, the background of the task force, and what it was tasked to assess. Page 4 is the membership and the background. This includes the key findings of the OLA report and recommendations of the OLA report, and then just meeting overviews of the field hearings that were held around the state. Also highlighting various issues that were identified as recurring across the state, and as well as including important statistics that were presented to the task force at that first meeting. Page 6 is kind of just a placeholder for possible potential future recommendations. Page 7, we've included a separate section for the EMS legislation that was introduced in the 2024 session. This was HF 4738 and SF 4835. This established the Office of Emergency Medical Services to replace the Emergency Medical Services Regulatory Board, appropriating $6 million to the EMSRB for a sprint medic response pilot program. It changes EMS personnel requirements and appropriates $24 million for aid payments to eligible EMS services providers. Page 8 is just an overview of the task forces that were held around the state. These were in Mountain Iron, Elbow Lake, Mankato, and Winona, and just includes a brief summary of challenges and discussion that were highlighted at each meeting. Page 10 will include impetuses that were just presentations and testimony, written testimony that were given to the task force. With that, that is the brief overview of the draft report as it is right now, and I'm happy to address any questions or feedback on it.
Thank you, sir. And note to the body that this is also available to you on the LCC website. I'm going to open it up for member discussion. Representative Backer, do you have? I knew I'd be going to you, so I'm just doing it.
I might say a few things here. So, no, most of us here that's here today was at quite a few of them, and we've had plenty of discussions about this. And I do believe our future is to find a source of income, because as we are all aware of, we cannot continue to provide EMS on the backs of the volunteers. We know that. And I did appreciate down in the southeastern part on what they did in regards with their hybrid program. You know, they staff it with a full-time medic, EMT, and backfill it with a volunteer. You know, that was one of my goals with the money that we were to, you know, the initial amount, obviously we got what we got. And I've talked to quite a few of the services in the district I represent and also outside of it. But I do believe that's where we're heading. And I also would like, I know we didn't talk about it during the task force, but the last couple of days of session, the no loads. We heard that out there, and as all EMS individuals know, that if the wheels don't turn, we don't get paid with Medicaid or Medicare. And I really, we came up with a formula, I came up with a formula with the help of Dylan, a lot of help from him, on the no loads. And that's something that's very important. I hear that especially in Grant and Otter Tail County, and that's where one of the areas that we had the Sprint Medic program, that's even though they're getting the money, it's those no loads that are quite concerning for our ambulances. Because I believe that if we can somehow find a source of income for EMS, I think that's where we want to go. And rightfully so. I'm one of the few lucky people that have a primary, so I've been door to door in Fergus Falls, where Ringdahl is, and it is a conversation that comes up at the doors. That would be my one of the big take. Go ahead, Chair.
Representative Backer, I really appreciate, as you know, we both had very spirited debates over this whole bill and this process, and I appreciate that. I don't think if everything goes your way and if you're like-minded, you're not going to be able to dig into it and really get to where it is. And we introduced the Sprint Medic model in this, and I've gotten numerous phone calls on that, good or bad. And I want people to know, and as you've talked to me about before, maybe that's not the answer. That the big word here that we tried to use this year was innovative. We need to be able to think outside the box in Minnesota. I think the new office will give us the freedom to do that. That's what our intention was as lawmakers, to what can we do differently that we're not doing now? And then, yes, the big question here that this focus will be for all of us, and I haven't talked to many of our members yet about this, but my recommendation is that because this is such an important issue, that the task force, or maybe becomes a committee, continue into the next session, regardless where the House sits, where the Senate sits. I think that we need to continue this to keep it at the forefront. That's why we have an office now. That's why we need to make sure that we look at funding. Funding is the key here. And where that money goes and how we make that investment in the state, again, Sprint Medics were just one idea. I talked to a director just the other day in your area, Representative Backer, and they said, well, I have this idea. And no idea is bad, and we will, I think, what I want to do is, as long as we have to keep looking for ideas, let's try to find funding for them. One-time money seems to be easier to get than ongoing. Ongoing is what we're struggling with, to be honest with you. We all know that.
Yeah, we know that.
We can't say, okay, let's give it $155 million this year and cut it off next year, because EMS will continue to grow, aging, and then we have, like Representative Zisakar will say, EMS is one part of this, but to move a patient, period, is a part of this. To move a patient from A to B, not necessarily in an ambulance, and most of us are doing it by ambulance now, but a wheelchair transport or something like that. We need to tackle those so we're not bogging down ambulance services with it, and that's part of this cost. This is all a part of cost. And so we have a big mountain to climb, but I think we started that this year. And again, Representative Backer, I really appreciate what the discussions you and I have had, again, spirited, but we got there, and we ended up with a really good, agreed upon legislation at the end. Are there any other legislators that would like to address this? You see any? Vice Chair? Oh, not Vice Chair.
Co-chair.
Co-Chair.
It's fine. Thank you, Vice Chair Hewitt, Co-Chair Hewitt.
The lesser of the two chairs, are you saying that?
I've really valued the work that we've been able to do on this task force, and I'm so appreciative of everybody who offered their input and their thoughts and their views on both what the need was and how we begin to address those needs. We heard consistently throughout the state what the needs were, and it's no surprise that money's an issue, funding's an issue, staffing's an issue, and just the demand on our EMS services and emergency rooms in the hospitals have exponentially grown over the years. And these are all things that feed into the evaluation and the thought process and what we've done as a task force to address the needs in emergency medical services. And I'm grateful for everything that I heard from everyone as we worked through this process. There were a lot of big feelings along the way, but a lot of good discussions and a lot of good ideas came out of that process, and that's what we need. Neither myself nor my co-chair claimed to have all the answers. It was the discussion and the input that we so valued. So I just want to thank everyone for their input during this process. I certainly hope this task force does extend into future sessions. I do think the need, we're just starting to address the needs out there in various services. There's a lot of additional work that needs to be done. When we start talking about our recommendations for the future, we're going to be looking out multiple years and really thinking, like my co-chair said, thinking of retooling the system, rethinking how we do this, rethinking how we deliver pre-hospital care to the people in Minnesota. Because the way we're doing it right now is not sustainable for the services. Representative Backer is 100% correct. Funding for no loads, funding for non-transports needs to occur, particularly when those calls can take up a disproportionate amount of a service's time. So how do we factor that in? What kind of a funding source can we identify? These are all questions and issues that we need to continue working on. So I would love to see this continue. I would love to see our work on this issue continue to move forward so that we can reimagine a system that works and continues to provide excellent care to the people of Minnesota. And I just want to shout out to all the providers out there, the clinicians that are in the ambulances working, doing more with less, and being paid on call or volunteer and going out and still providing excellent service. Everybody that I've spoken to, both provider and resident, has nothing but good things to say about our EMS personnel out there in the field right now. Those that are out there working in the field do it for the love of the job, and they do it really, really well for the most part. So I'm grateful for everyone who's in the field serving on an ambulance in whatever capacity out there delivering high quality and excellent pre-hospital care. So I want to thank everybody who was on the task force, everybody who came out to see us in the various cities that we went to. I want to thank Executive Director Dylan Ferguson for all the help and support that he's given us in dealing with a lot of the nuts and bolts and answering all of our questions. We had many to really wrestle with a lot of these issues that we may not have had a super clear understanding of. So I'm grateful for all the work that we've done and all the folks that have shown up to help us work through this process.
Senator Hochschild?
Hey, thanks everybody. Sorry about that. I was trying to find the raise hand button. So thanks for the opportunity. I'm really proud of what we did this last session. I think it's worth continuing to tout that. It's been, over a decade that this has been something that's been bubbling. And I think especially on the Iron Range, a lot of folks feel like they've been talking about this and yelling about it and trying to get results at the state level. And I know Representative Hewitt, you especially, and Representative Backer have been involved in this for a long time. And I think just taking a step back and realizing like, wow, we came together, we created this task force, and we passed both meaningful reforms that were needed and aid and innovations all together in a year. Looking at the OLA report, sort of figuring out what we needed to do. The job is not done, but realizing that we did something feels like it wasn't that hard, but for some reason it hasn't been done for so many sessions over time before this. So just really appreciative of your leadership, both as chairs, Senator Seeberger and Representative Hewitt, as well as the bipartisan support around this issue and working with people like Senator Lang and Senator Rasmussen and Senator Seeberger on the bill on the Senate side. It was just really special to be a part of something where it wasn't the normal partisan bickering. It was like really sitting down and figuring out how to do this best. I'll also say the locals in my district who have been involved in this for a long time are really appreciative. They don't think it's perfect. They're questioning the Sprint Medic model, and that's okay. We always have to try things. Change is difficult, and testing out new ways of doing things is not always perfect. But I've been telling folks that we took a step in the right direction, and they wholeheartedly agree. So I think making sure that we realize that not everything's going to be perfect, but that at the end of the day, folks are happy that we produce some results and help support the locals where, again, like we've talked about ad nauseum, they're facing additional challenges in greater Minnesota. I do want to just very briefly touch on a study that was done by the Ely Hospital, a very rural critical access hospital in my district, sort of in the heart of where the biggest challenges are. They worked with a consultant to put together a study on how they might be able to consolidate services and get better reimbursements in order to make this work. So they are looking at an opportunity to bring together the Ely Tower and Babbitt services. And what they found I thought was really interesting, which is by combining those primary service areas, they would actually create a longer distance from their hospital in order to get a higher reimbursement rate at the federal level. When I saw that in their study and in their report, I thought to myself, how has this not been talked about before? And maybe it has. Maybe this is something that a lot of experts know that, you know, if we just tried to bring together more of our primary service areas, the reimbursement rate actually increases substantially to make it more financially viable. But that's just a really unique way, I think, that the locals in my district are looking at ways to try to make this work. And I applaud a hospital like Ely, which is a very small, rural, like I said, critical access hospital that does not have the resources of a large conglomerate like you see in the Twin Cities or other places. So for them to step up to the plate in this moment and say, hey, we actually think we could take this over, we could do this, here's sort of our study on how we do it, that's a really special thing. And the reason I bring that up is not because it's our decision of whether or not they move forward with that. That's a local decision. But what it brings to mind for me is how at the state level can we encourage other hospitals, other primary service license holders to say, wait a second, let's look at ways that we can cooperate and consolidate to be more effective and more financially viable. If we at the state level, beyond just the one-time aid that we did this last year, which was really important to stop the bleeding, if we could look proactively at how we might be able to incentivize our local license holders to come together to get those higher reimbursement rates, I think that would be a good use of money. Maybe it's one-time money to help that transition, to your point, Representative Hewitt. I'm not sure, but I do want to bring up, I want to look to the future of how we can help the locals make the best decisions that are best for improving care in their region. Lastly, to that point, we do have to think about the inequities in the system. Like we've said time and time again, and I've been harping on this over and over again, EMS is making money when you combine all the licenses in the state. They're making money. It's an inequity issue with our rural communities. The rural communities are the ones that are in the red, the ones in the suburbs and the Twin Cities are in the green. And that's not to admonish, the Twin Cities. It's just to show that a lot of those are private licenses, a lot of them are denser, and the reimbursements work better. But we've got to figure out how to make that work better at the state level. So figuring out how we might be able to spread that wealth around to the communities that really need it, because at the end of the day, life-saving first responders and ambulances should be a service that everybody can rely on regardless of their zip code. This should not be something where we have these inequities moving forward. So I'm hoping to continue to work with you all on that, whether we have a task force or not. But there's really a chance for us to spread that out and make sure that all our services are viable. And with that, I end my comments. Thank you, Mr. Chair.
Thank you, Senator. Representative Zlestakar?
Thank you to Representative Hewitt and Senator Seeberger. You've been fantastic in a bipartisan way as we went around the state. First, I want to thank the first responders for what you do. In greater Minnesota and the suburbs in Minneapolis, St. Paul, I've served seniors for 40 years, and I can do that, but I couldn't do your job. And it was pretty phenomenal to hear the stories across the state. And with that said, I was skeptical, and Rep. Hewitt and Seeberger knows on the sprint model, and I shared my concerns, but I've always been a person that tried innovation and figured out how to pivot if it didn't work, and then try something new. And so I've come to accept the fact that I have some reservations, but we have to try this, and it may not be the be-all and end-all, but it's something. It's a reality that the EMS staff have been struggling since 2002. And so it's 2024. So it's beyond time to do something, and so we have to try something. And I hope this committee continues in the piece of the non-emergency transportation, because the fact that we have the greatest aging population in greater Minnesota, and I just was at the aging task force before this, and the demographics are unbelievable. And with the model that everyone's going to be at home, I'll guarantee you they'll remember how to call 911. And so you have to respond. That's just the law, and you're going to respond. But you cannot continue to have no reimbursement for no transport or transporting people from a rural hospital that doesn't do the services, the specialty services like we're seeing. To be efficient, we have to work together. So we're transporting people to the regions where there's the large hospital system. For us, it's Duluth. But they're coming from Ely, they're coming from Grand Marais, they're coming from Silver Bay, they're coming from Two Harbors, they're coming from townships. And the first responders sometimes are the fire department. It's a volunteer fire department where I live. We have 14 townships, and they will respond. Sometimes they live closer, and they will get there as a first responder. So we have to find ways to appreciate that side of it too, and in greater Minnesota, and adequately partner with the EMS side. And I think we'll get there, because 70% non-emergency runs and calls is something that can't be ignored. It just can't. So I'm looking forward to moving forward. I mean, the basic model of how we staff and the advanced model, I think we've all spent time looking at that and looking at, without a doubt, reimbursement. If you don't reimburse, if you just have mandates without money, it implodes. And unfortunately, it took implosion to get creativeness at the table. So I'm thankful that we're doing something and that we're moving forward. And I think we have fantastic EMS staff across the state that will give insight and give guidance, and we will just make things better. And so I appreciate being at the table and look forward to moving forward. And, you know, the issues are there and they're not going away, but I think we're going to go around the tree a little differently, and that's a good thing. So thank you.
Thank you, Representative. We will vote on this report at the end. Mr. George, thank you for your information. I'd now like to move on with the committee and have Mr. Ferguson come up and present the status of the laws that were passed, where we're at, and what's going on at this point. Mr. Ferguson, if state your name, title for the recording, please.
Good afternoon, Mr. and Madam Chair. My name is Dylan Ferguson. I serve as the Executive Director for the Emergency Medical Services Regulatory Board. And it's my privilege to be here today to update not only task force members, but the EMS community overall where we stand related to implementation of House File 4738, the fifth engrossment. Before I get started, though, I wanted to take this special moment to recognize that this law, as it's written, has not yet even been effective for a full month. Most of the provisions became effective July 1st. And we sit here today, July 25th. And if you take a look through your packet, I hope that your response is similar to that of mine, as a great deal of work has already been conducted. A lot of items have already been completed. And for that, I wanted to take a moment to recognize my staff at the Emergency Medical Services Regulatory Board. They have been nothing but phenomenal the last, really, since my 2.5-year tenure here with the state of Minnesota. but really the last 2 months, they have truly gone above and beyond. And the work that we're about to discuss wouldn't have not been possible without them. I also want to recognize the present board, Chair Sarah Rabarczyk and Vice Chair Brian Edwards. They too have been nothing but supportive of myself and the staff as we carry out our statutory responsibilities under 4738. So the presentation that you have before you and that we'll just do a quick walkthrough tried to make it pretty simple. The boxes on the left are going to refer to the portion of the program that was passed in law that I'm updating you on. And I have tried to include line numbers in case anybody wants to follow along at home. And those line numbers refer to 4738, the fifth engrossment. And then the boxes on the right are going to relate to where we presently stand. So throughout the last legislative session and through, I think, the majority of the task force meetings, the two themes that I heard overall were workforce and funding. So that is when it comes to implementation priorities, that is where I have focused the resources of the staff and the state in ensuring that those items were implemented first, as they are, the most important to the EMS community. The first program we'll talk about is the BLS staffing variance. This was included on line 32.30. This is the program that allows a BLS ambulance service to apply for a variance to the board or in the future to the new office, and to be able to operate with one emergency medical technician and one driver. That driver is still required to have a CPR credential, a driver training course, and to make an application to the board. But I will just highlight that CPR training and that driver training is not prescribed by the state. In fact, that is prescribed by that local ambulance service medical director. There were 8 ambulance services that applied for that variance between July 1st and July 19th. All of those services that had applied for that variance had that variance approved at the July meeting of the Emergency Medical Services Regulatory Board. Also, as of 3 days ago, there were 4 individual driver applications that had been submitted to this to that point. The next program that I have for you generated a lot of discussion at the very end of the session, and it related to creating new practice pathways for registered nurses within practice of ambulances. So there was a change to one existing pathway and then a new pathway which was created. Registered nurses who also hold the certification of emergency medical technician, they no longer have to take the paramedic skills exam as was previously required. And that's the reason for that was because that skills exam was retired by the National Registry of Emergency Medical Technicians. That was replaced with essentially local ambulance service medical director approval of that RN EMT to be able to practice at the paramedic level. The new pathway, though, that was added was that registered nurses who hold a certified emergency nurse credential or a certified flight nurse credential can operate on a ground ambulance at the paramedic level as long as they have made the necessary application to the state so that their RN license can be verified and to ensure that they have the proper credential as required in law. Those new application types were created in our license management system, and they went active on July 1st, which was the effective date of the legislation. At the present time, there are no pending applications for that, but we continue to do outreach and continue to communicate with ambulance service managers across the state. So, we do expect those applications numbers to rise, but I did want to highlight that they were ready to go the day that the law was effective. The expanded reinstatement window. This appears in line 39.1. This was the temporary option, which would be good for 18 months to allow any EMS provider at or above the level of an emergency medical technician to regain an expired EMS credential with the completion of a refresher course and to have the approval of an ambulance service medical director. This program will expire December 31st of 2025. We, once again, had this application ready to go on July 1st. We sent an email with this information to 21,969 qualifying individuals on July 2nd. There were 11,015 who opened the initial email, and we actually have one pending application right now. And we made it clear that in order to submit the application, you needed to have your education done and have your medical director approval. So it is my hope that perhaps individuals who were not able to keep up with education requirements as a result of the COVID pandemic, or if they had other factors which took them away from EMS, that this creates an expedited pathway temporarily to regain them into clinical practice. We continue to plan additional outreach over time to make sure that anyone who is potentially eligible for this option is at least aware of it. I can't force anyone to come back, obviously, but it is my job to ensure that statutes are followed and that people are aware of the information. Related to the emergency ambulance aid, the $24 million that I know that you spent a little bit talking about in the introductory. Line 43.1, this is the formula-based approach, which appropriates 40% of funding to square mileage, 40% based on the number of EMS responses, with lower response volumes being weighted heavier, and then a 20% equal share across the board. I'll just highlight for members of the task force that there have been a couple of different local government groups that have done some projections. I'm aware that the legislature did some projections as we were going through the very end of session. I'll just highlight that those final numbers will not be available until after the application window closes. Those calculations have to be performed by the Department of Revenue. And that application time period, those applications are going to be due to be submitted on September 16th. We've been facing a lot of questions recently as to when that application will become available. And I'm happy to report that I received an email from the Department of Revenue this morning that application is going live. So as soon as today's hearing concludes, I will be returning to the office to work up a Gov delivery to share that updated information with ambulance services and constituents across the state. I do want to highlight that Department of Revenue, particularly the Property Tax Division, has been fantastic to work with. This has been very much a collaborative approach between our two agencies. Certainly, as the lead EMS official, I recognize the importance of this funding, but it was very refreshing for DOR to also recognize how important this aid and this program is. And Chair Hewitt, I do note that Senator Hochschild does have a hand up. I don't know how you want to handle questions. If you'd like me to just finish, okay. So I did want to provide that hot off the presses information about the emergency aid package. Related to the pilot project of the Sprint Medic, which has certainly gotten some discussion here earlier this afternoon, this begins in line 15.29 and is the $6 million appropriation, with that appropriation going to Otter Tail County and to St. Louis County. I will highlight that this funding is valid through June 30th of 2027. And I would like to express my gratitude to the task force and to the legislature for having that prolonged appropriation period. This is something that is new. It is something that different areas of the state, I think, were perhaps more prepared for this than others. And it is something that it takes time to set up. It will take time to identify, how this is going to look, to procure the necessary equipment, and the fact that we're not having to rush to have those funds spent by June 30th of 2026 is truly appreciated. So as it stands currently, there have been collaborative groups that have been meeting within each area, working on what their operational plans could look like. EMSRB, myself, and members of the staff have met to offer technical assistance and to answer questions where we can. I will tell you, in certain areas of certain pilot sites, there are conflicts of vision, and there are conflicts of what different organizations believe that this should look like. I will just highlight that this is a legislatively directed grant, which means that after consulting with the Office of Grants Management within the Department of Administration, it will be St. Louis County and it will be Otter Tail County that will file those grant applications with the EMSRB for those grant contracts to be created. So we will continue our conversations and our technical assistance to the individual ambulance services and continue our conversations with the respective counties as they will be the fiduciary and the signatory for both of these grants. We are working on finalizing that grant application that those counties will submit to us. And then upon those grant applications being finalized, grant contracts will then be drafted and created. Those grant contracts will have to be approved by presumably the respective county boards, in addition to the Emergency Medical Services Regulatory Board prior to them being executed. There was a question that came up, I believe probably about a month ago. I will just highlight that both of these programs, I say in the PowerPoint, may not go live at the same time, but realistically, they likely will not go live at the same time. And that's okay, because certainly we don't want to unnecessarily or administratively hold back one entity that is ready to go, whereas another might need a little bit more time and development. But also then just understand, based on the available funding, one program may end before the other program ends. So that is the updates that I have related to the pilot program. And then the last kind of highlight that I have for you this afternoon relates to the creation of the Office of EMS and the EMS regulatory structure in Minnesota. At this time, myself and staff have been working with the small agency resource team within the Department of Administration to ensure that all accounting and back-end budgets and all of the administrative processes that are necessary to stand up a new state agency are being completed to ensure that those things are ready to go for January 1st. As the executive director for the EMSRB, currently participating in the fiscal year 26-27 budget development process. All state agencies, I believe, are required to have their budget narratives back to Minnesota Management and Budget by the end of July. I'm happy to report that budget books for, at least budget narratives for both the EMSRB and the future Office of EMS were complete and sent back to MMB ahead of schedule. But the one thing that I want to emphasize, not only to members of the task force, but to the EMS community across Minnesota, regardless of the changes in regulatory structure, the Emergency Medical Services Regulatory Board remains on the job, doing the work, and working. It's my personal mission to ensure that there is as smooth of a transition as possible to ensure that the important work that the state of Minnesota has in supporting of emergency medical services does not falter. Additionally, the EMS Advisory Council, which was specifically identified in the bill, along with the two other advisory councils, the Advisory Council is posted on the Office of Secretary of State's page. There are 3 positions that are not direct appointments, but rather are open appointments, and those are the 3 public members. That council and those positions have been posted on the Office of Secretary of State's page as required by law. All of the other positions are likely direct appointments, and it is likely that direct appointments from those organizations will likely be solicited sometime in the October timeframe. Those individuals have to be in place by January 1st of 2025, and each advisory council is required to have met at least once by the end of February of 2025 pursuant to the statute. So those are the updated items that I had with you related to current progress. And Chair Hewitt, Chair Seeberger, as is often the case, I am happy to take any questions that you or members have.
Well, thank you, Mr. Ferguson, for your detailed information and definitely your hard work. We knew this was going to be a hard lift. We know the person that's doing it for us is doing a great job. You've been great at updating us. You've been great at walking us through the process. And I really appreciate that personally. This was definitely probably one of the hardest things I've ever done in my life. And I really, really appreciate, even though you didn't agree, you still helped with where I had to go as a politician. So we're going to have a couple of questions here from the members, and then we'll circle back. So our first member is Senator Hothschild.
Thank you, Mr. Chair, and thank you so much, Mr. Ferguson, for your report back. I agree with Representative Hewitt that you've done a good job at reporting back to us, and I look forward to hearing more as we move forward. I'm wondering a couple of things regarding the September 16th deadline. Is there a way for your office to let legislators know who within their primary service area license holders have applied for that aid and who have not before that deadline, in case our offices can do any outreach or help inform license holders that they have?
Mr. Ferguson?
Chair Hewitt, we do plan to track those services that we know to be eligible and that we have not received an application from, and to try to do follow-up with them. I don't necessarily know if I have a great way to be able to specifically identify what ambulance service falls in any given legislative district. However, unless there is some provision of the MGDPA that I am not aware of, I don't see an issue of, kind of sharing that application status, at least overall, to show, who has applied or who has not yet applied, and sharing that list, certainly at least with members of this task force, and then for further distribution. But I will just assure you that, we will be tracking that, as will the Department of Revenue, because the applications will come to both state agencies as specified in the law. And it's going to be my personal goal that this information, I want ambulance service managers and city managers, I want them to get sick of it showing up in their inbox, and that they finally just go and complete the application. But I certainly have no difficulties in trying to be transparent with that. I just have to make sure that it doesn't run afoul of the Data Practices Act.
Thank you, Mr. Ferguson. I think that's important that we see it, but we also will get it out to our colleagues too. That's, I think we have to be as transparent to the districts. I don't expect you to know our legislative districts, but we know who the members are and we can get it out to them. Senator.
Thank you, Mr. Chair. And then just on the Sprint Medic model, certainly, anything that our offices, for those that have it in our districts, Senator Rasmussen, myself, Representative Backer, and I think maybe part of Representative Zalesnikar, although I'm not sure, please let us know if we can be helpful with any of that process. We're the ones sort of on the ground in touch with a lot of these ambulance services and can be helpful in any sort of communication or outreach or just anything you might be working on. We definitely want to be proactive, or at least I do, and I'm sure the others do as well. The last thing I wanted to ask, and forgive me for not knowing this offhand, with the restructuring that we've done, what authority will the office have to look at primary service areas sort of proactively since the last time that we have changed them? Do you have any ability to make recommendations of any sort to the legislature for those primary service areas as part of the restructuring that we've done, or is that still a topic to be discussed?
Mr. Ferguson.
Chair Hewitt and Senator Hochschild, as it relates specifically to the bill, House File 4738, Section 3, Subdivision 3 in powers and duties, does identify to establish and modify primary service areas. That being said, without additional context specifically being put in there, there would not be immediate authority on day one to make any changes to a primary service area. As most of the lawyers in the room or listening to, there are any number of factors of Chapter 14 of the Administrative Procedures Act, which have to be followed as it relates to any type of administrative rulemaking activity. So that would largely depend on what that rulemaking process looks like, what the different policy initiatives might or might not be of the new office, and it depending on the interpretation of the administrative law judge or any subsequent judicial review as called for in Chapter 14.
Mr. Ferguson, just to clarify this, nothing in the PSA law changed in the changeover to the department. Basically, what it did is give the new department the same power and ability the board had. Is that correct?
To the best of my recollection, the application process under Minnesota Statute 144E.11 remained intact and unchanged, and the provisions of Minnesota Statute 144E.13, which deals with the protection of the primary service area, also remained unchanged. And that is the one aspect that I would highlight to everyone, that in general, rulemaking is used to clarify things and to add additional specifics. But remember that state agencies must be creatures of statute. That is from which all authority emanates. So rulemaking cannot be in direct conflict with a statute. And that's why we have the judicial review process with the Office of Administrative Hearings, Mr. Chair.
And just to reiterate, we got this part, we watched this very closely as we were writing this bill, all of us did, and this is where Representative Backer and I had many discussions, Senator Seeberger, just to put people at rest. This was not a targeted area. This was basically, we were told by the auditor to keep this intact, and which we did. We did not change a thing about this part of the law. So, Senator, do you have anything else?
Thank you for that clarification, very helpful. I just kind of wanted it to be reiterated, and I'm glad for the broader context. I think my interest is, how do we look at primary service areas given that they were created in the 1970s and have not been changed? So understanding that there's a lot of administrative law and challenges to being able to do that from a bureaucratic standpoint, totally understand that. However, I would love for this task force or for us as legislators to consider opportunities for some sort of recommendations or studies to be done on primary service areas, because I do think that is one of the areas that still need further looking. So appreciate the time. Thank you.
Thank you, Senator. And you're right. I think we do have to I think that's another reason to keep the task force intact, because this is a big area that we need to look at, and this subject cannot be taken lightly. We pride ourselves in Minnesota as being one of the states that did this to begin with, and we don't want to break something. So, moving on, Representative Backer.
Yeah, thank you. Thank you, Chair. Co-chair, or vice chair, as Senator Seeberger said. You are correct. You are correct. We do have other names for you. So we do. All positive. But hey, first of all, let's talk about the Sprint Medic program. I understand that's Otter Tail grant, but am I correct, Executive Director, what you're saying, though, it goes through what the agency has, the board has determined, the grant process has to go through Otter Tail County, because a portion of that was Otter Tail grant. Senator Rasmussen and I have met separately with Otter Tail County, and then we also met separately with Grant County. And so I just want to make sure that's clear, because there are different dynamics to how each county provides EMS service and so forth. So I just want to make sure we're on the same page, because our constituents have been in our ear on that. So if you could address that, please,
Mr. Ferguson.
Director Ferguson.
Mr. Chair, Representative Backer, that is, your understanding is correct. That funding is required to go through Otter Tail County. Line 20.2, $6 million in fiscal year '25 is appropriated from the general fund to the EMSRB for grants to Otter Tail County and St. Louis County. Because those entities are specifically enumerated in statute, it becomes a legislatively directed grant, and that is those two entities are the only ones that, as a state agency, I have the authority to grant funds to. Mr. Chair.
Representative Backer.
Yeah, thank you. I want a clarification. I suspect we will be working together on that, and along with Senator Rasmussen on that, so over the next couple of months and so forth, because I suspect, well, not suspect, I know Grant County has a different vision than Otter Tail County on how to use it, and on the western part of Otter Tail County, especially with Fergus Falls and Pelican Rapids, is different than the vision that PERM and that group has. So I think we will be innovated, just to make sure that it works well, what it's intended for, okay? I understand this is something very important to Senator Seeberger, which I respect. At the end of the day, we want to make sure it's used correctly, and so forth. I was never the main cheerleader for it. It is in law, and I want to make sure to work with the senator's wishes to make sure it's what it's used for. The second question, and this is more so a comment, is not, I mean, all you have to do is go back and watch the floor debate between Chair Hewitt and I on those final days. I have never been a supporter of the office of EMS. It's not something that I have. Now, I know it's in law, so what I would ask, I know we do not know who the executive director will be, if it tends to be someone in this room. I do want to work very closely with that director to make sure that we have the correct focus on, you know, I know the PSAs in the metro area with the hospital systems are totally different than the PSAs in greater Minnesota. If somebody wants to come in greater Minnesota and take us over, you can have it, okay? I'm joking, of course, but we are losing money. We don't make money. I think we all would agree that it's very important that we want to improve care. I would hope the office would do it. I'm skeptical of that, but at the same time, I'm not here to sabotage it, okay? I want better care. I want additional funding for EMS. I personally see that the hybrid system in southeastern Minnesota is the direction we should go with. we did get a good start. So, and it's not an arrow in anybody's back, it's just something that's, June 27th was my start of my 30th year doing this gig. So of course, it's part of my blood now. So I just make that statement. And you, right now, from what you're sharing, it sounds like the staff wants to follow legislative intent. I know we had spirited discussions, and sometimes those legislative intents might not be always put down on paper. So I just put that out there on record as we move forward with this agency. That's something I want to be engaged with, working with, because I know you said that it's up to the new department to make those changes. It's really up to the executive director, because all that rulemaking, yes, you have to follow those steps, but that rulemaking does rest on the shoulders of one individual eventually. So that's my statement that I have to say about the agency. And it looks like Chair Hewitt might have some comments.
Representative Zislikar.
So I'll take it that you agree with me. No, I'm just kidding.
Thank you, and thank you for your presentation. My questions are in regards to the 6 million split. My assumption is that 3 million is going to Otter Tail and then 3 million to St. Louis County. Then is your perspective that St. Louis County, the commissioners, would be determining how that 3 million is allocated within the north part of St. Louis County and the south part of St. Louis County?
Mr. Ferguson, sorry, I was waiting for your answer.
No problem, Mr. Chair, Representative Zalesnikar. That's certainly one direction in which that could go. Right now, where we have been trying to channel these conversations as much as we can is within those groups of EMS providers that are meeting collaboratively to have these discussions, is to reach some level of consensus so that they can make a recommendation to the county. Specifically to the discussions in St. Louis County, a lot of those discussions are being brought together by the Arrowhead EMS Association, which is the Northeast EMS region. So it is my hope that, we are trying to empower the local ambulance services and local elected officials to identify what is going to work best for their respective communities. Because we recognize that the geographical intricacies of St. Louis County are far different than the geographical intricacies of both Otter Tail and Grant County, both from population density and to the just sheer size of the individual primary service areas. But I will also have to, recognize that as legislators, I'm sure that you are aware, all politics are local. And, there have been, and I'm not going to attribute these to one site or the other, or even that it's within one of those two sites. But within the public safety community, we know that there are certain individuals who play nicer with other individuals, and it very much goes back to similar things that you may or may not have seen as legislators when it came to school redistricting. And how those different local government and those local service kind of interact. So our goal is to try to, allow as much of that to be worked out as at the local level as possible, because we know that trying to impose any type of program from a top-down perspective is likely to not end as successfully as we otherwise might have liked.
Representative?
Thank you for that response. My second question is, for the allocation, is there going to have any priority to the areas that don't have the advanced model for the Sprint Medic in the application process? Or is that part of the thought process?
Mr. Ferguson?
Chair Hewitt, Representative Zalesnikar, by the definitions of the pilot, the answer would be yes. The only thing that this can really be used for is for to use the language of the law, the supporting ambulance service, which is a full ALS licensed ambulance service, who's providing the services to a primary ambulance service, i.e. the basic life support ambulance service. It really wouldn't make logical sense to put a ALS chase car into service for it to only serve an ALS primary service area. It may be based within that primary service area, depending on the local deployment decisions, but its primary purpose will be to serve those BLS ambulance service. And that's written, at least from my interpretation, through that thread of the language of the definitions of what's a supporting service, what's a primary service, et cetera, et cetera.
Are we good? Mr. Ferguson, once again, you continue to amaze me. To know about our school redistricting when you weren't even in our state. I wasn't even a rep at that time, but you're right. That's exactly the level of pride, the level of angst that a lot of people had during that time. And I think we're about to experience that in EMS also. This was quite an emotional process for both the senator and myself. She was not on board with this when we first started talking agency. Two moderates sitting in a room to create a state agency was not really on our agenda. We had tons of other stuff. But the problem is that we had an obligation because we are from this industry. And our love for it and our love for our patients overwhelmed what we had to do here. The system, I don't think was broken, but it was time for an update. This is not, the agency wasn't created because of you or because of the current EMSRB staff or the board. We just know we had to do something and we had to move it forward. And the more we saw and the more we were advised by legal and the more we were advised by the audit, we had to look at something that wasn't tried before, because every state has done similar actions to what we have done. But we have to do something different. We have to empower EMS. I think this will do it. And we don't want it to fail, and I think I heard it in his voice, but I think he said that, yes, we need this to be supported. We need to make sure, because this is way too important to fail. And that brings me to the next part of this discussion. As we hope that this committee will continue, or this task force, we need to look at funding. This is plain, simple, straightforward. The numbers I've heard about that I've studied and that I've been advised on is anywhere from 90 million a year to 170 million a year to fund EMS adequately throughout the state. And these are not numbers that are pulled from somewhere. I mean, we looked at the state patrol, we looked at all these other models, and it's so uninteresting because that same discussion I had with that director the other day, I've had with other directors. Our directors and our ambulance services cannot think innovatively. It's just like anybody else when they're basically in a financial situation, they're trying to save their house. They're not going to worry about watering their grass. They're going to worry about basically, how do I save the house? Our ambulance directors are having trouble putting tires on the rigs. We need to figure this out because this is not right. As our rural healthcare facilities shrink in size and sometimes leave our communities, this might be the only source of healthcare in our rural communities, or even in our metro communities. Talking to the Hennepin County medics, if they had treatment non-transport, they would be able to do a lot more and get a lot more runs in a day. And we need to look at this, and we need to be innovative, but we can't right now. Well, we can now. We made it. So our next step here as this task force is we're announcing a trip, tentative dates, September 23rd through the 25th, to Washington, D.C. to meet with our federal delegation. We need to know what they're willing to do to step up and help Minnesota. Minnesota made a big investment, more than any other state in the country this year. I know it wasn't what we wanted, and it wasn't even close to where we needed to go. But the 25 that we put into it said something throughout the country that, hey, Minnesota's there. We need our delegation in Washington, including the White House, to come forward and start taking EMS serious and start looking at innovative models. And I think EMS can be led through the country, through Minnesota. We have some of the best minds here. I know, we listened to them when we were on the road. That's where we need to go with Minnesota. And the whole delegation, a bipartisan delegation, Jeff and I are friends, regardless what it looks like, have decided that this is something we need to take the charge on. And we invite you to come with us. Unfortunately, we can't pay for you, but we can definitely invite you in the room because you should be there. They should hear your stories. They're going to hear ours. They're going to hear what we're running up against as a state and what budget challenges we have. I mean, we're going to have, it looks like right now we might have another small surplus. I want that money for EMS. Now, there's a lot of other people with their hands out too, but I think we got to start taking this seriously. Stop working against each other and working together. That's where we have to go. And so that's what the task force is looking at. That's one of our charged items. The other one is definitely to support the Office of EMS. As legislators, we cannot take a position on the executive director, but you can ask any of us privately who we want that to be. We are in a tight spot right now, but I gotta tell you, from the board that's there right now to the previous boards, you did a good job. You brought us to this point. We're the first state in the country that has an office of EMS that reports to the governor. This is really cool. We now have power. Let's take advantage of that. And you brought us there. This is your work. So let's move forward. And on top of that, we need to support the office. We're going to make mistakes. They're going to make mistakes. Let's figure out together how we're going to do it. So, Mr. Ferguson, I have to give you and your staff a big thank you for working with us, for doing what you did. I know this was not a good time. And we know that because all of us called. And you were working with us very bipartisan, very diplomatic. And I've talked to both the leadership in the House, both the Republicans and Democrats, and we're all on the same boat here. We're all on the same page. Now, as your elected officials, we have to push forward and get this done. Get it done. Let's move Minnesota forward, especially in EMS. So saying that, we have one little action. What's that? All right, we can let them talk. Okay, anyone else would like to speak after I gave my little eulogy there? Jeff?
No, yes, Chair, I would agree with you. We were not always easy to work with. And so I do appreciate the executive director and all your efforts and your staff, and actually everybody in EMS. We went through to several locations. Several of you came to every location. As an EMS provider, you may not start that it's part of your blood, but once you serve, it becomes your blood and life and stuff like that. As we all know, we make sure if we go someplace, we always have our pager or our cell phone if we have it on our cell phone, and so forth. So, but I cannot say much more than what Chair Hewitt did on how you handled yourself and also the EMS providers with questions. So thank you. Well said. See, you're getting a compliment. Are you going to be able to walk out of the room now?
You want to endorse me? The camera's there.
I talked to your opponent this morning, so no.
All right. So hearing that, Senator Seeberg, I believe you have a motion.
Thank you, Mr. Chair. I move that we finalize and adopt the task force report and incorporate the recommendations of the co-chairs and authorize staff to prepare the report and include any technical changes that are necessary.
All those in favor of Senator Seeberg's motion, say aye.
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 Any opposed? Hearing none, the motion carries. The report can be submitted. This being our last scheduled meeting, we will watch the website for any other updates. I'm sure we'll be back probably by the end of the year, after the election, probably more case after Washington, to get a final update, see what the outcomes of the election are. I'd like to thank the LCC staff. They've done outstanding work. I don't know how they got all our voices on those recordings, but they did. Andrew George, Sally Olson, Megan Volker. We have an unbelievable House staff and Senate staff. These are the people that basically, when Judy and I are in another meeting, making us get here on time, even you saw that today, making sure that you hear the voices of us and know that the paperwork comes out. I don't know what seriously, this was my biggest fear as a legislator, staying organized, getting stuff out. These are the people that make us all look good. And I have to hand my, Brenda from the Senate, Jonah, Maya LA, and Josh, you ran this committee, and everybody knows you ran the committee. You just told me what to do, or Judy, so. So I really appreciate everybody. Leadership for recognizing that this needs to be done, and I mean leadership on both sides of the aisle did that. This was not just a Democratic idea, this was a Republican and Democratic idea to get this going. And so I hope after whatever happens in this election, that this committee can stay intact and continue the good work and keep the communication going. For all you that took time out of your schedule today to come down here, we appreciate it. You might not agree with what's going on, you might be more spirited about it. That's okay, because that's how we got there. All of you know that you've been in a truck with a partner that maybe you were a little spirited with. Use those times to pull to this and try to talk to Judy and I when you can, so we kind of know where you're at. We appreciate an open line of communication with you. So, saying that, we are adjourned. Thank you.
Thank you.